Hello, I'm Nikhil Munshi from Dana-Farber Cancer Institute at Harvard Medical School in Boston, Massachusetts, and I'm presenting the abstract discussed at the recent EHA meeting on CARTITUDE-1 Final Results, a phase 1b/2 study of Ciltacabtagene Autoleucel or cilta-cel in heavily pretreated patients with relapsed refractory multiple myeloma. These are my disclosures. Now, cilta-cel is a dual-binding BCMA-targeting CAR-T cell therapy, which is approved as fourth-line treatment in Europe and as fifth-line treatment in the United States in relapsed refractory multiple myeloma. Now, long-term data with this molecule in the first-in-human LEGEND-2 study showed overall survival with this product of 56 months, which is far out over what the standard of care would be, which is between 9 to 12 months. So this phase 1b/2 CARTITUDE-1 study was conducted and was reported earlier to induce early, deep, and durable responses in heavily pretreated patients with myeloma, and at a 27.7-month PFS and overall survival of 54.9 and 70.4 months, respectively. So with this background, the objective of this presentation was to look at the outcome with a longer median follow-up of 33.4 months at the time of study closeout. So the primary endpoint of these studies in the first B component was safety and dose confirmation, and phase 2 was overall response, with the secondary endpoint of PFS, overall survival, and MRD negativity at the depth of 10 to -5 sensitivity. The eligibility criteria included patients who have had 3 or greater lines of prior therapy with progressive multiple myeloma. Overall, 97 patients were accrued, and as of October 14, these patients were treated, and now with a median follow-up of 33.4 months. Patients had received median of 6 lines of therapy, range of 3 to 18, and 25% of the patient had high-risk cytogenetics. Importantly, the study included diverse patient population with close to 18% patient with African-American descent. Patients, around 20%, had plasmacytomas, and they were refractory, with 42% patient penta-refractory, and 88% were triple-class refractory to the previous line of therapy in this study. Now, overall response has been reported previously, and it was 98%, with 82.5% patient achieving a stringent CR, an incredibly high response for this advanced patient population. Now, the update presented was that at the median follow-up of close to 3 years, the PFS was 34.9 months. The duration of response was close to 34 months, and estimated 62.9% patients were alive at a 3-year follow-up. Importantly, achieving CR or sustained MRD negativity was associated with prolonged PFS. So at 30 months, patients achieving CR were 66.8%, and patients achieving a sustained MRD negativity were 74.5%. The sustained MRD negativity was defined as patient having more than 2 MRD negativity assessed 12 months apart without having any intervening MRD positivity. And in this group at 30 months, 75% patients are without relapse. If you look at the further biological data, there was no association between CAR-T positivity, expansion, and persistence and clinical outcomes. So as you see in the left side, what we call T-last, when was the last time CAR-T cell was detected in patient, was 98 days. And if you look at patients in the middle curve who either got less than PR, VGPR, or stringent CR, the C-last was very similar, suggesting that the persistence did not impact the outcome of this patient population. The two patients highlighted on the left side, the light blue and the dark blue, shows that the CAR-T cell count over time, whether it was persistent in the light blue or was limited in dark blue, to good outcome patients were very different, but they still had a sustained remission in this population. And finally, we look at the PFS with Cmax, the expansion. Patients who had less than 25% versus more than 75%, the curves are overlapping, suggesting that this Cmax did not correlate with the outcome or PFS in this patient population. Very important point as we develop next lines of therapy here. About the toxicity and safety, the safety profile was manageable and no new neurotoxicity events were reported since the previous report with a 27.7 month of follow-up. During the study period, 26 second primary malignancies were reported in 20 patients. In this update, 4 patients had 6 reported second primary malignancy, included 2 cutaneous, 2 hematologic, and 1 prostate cancer. Overall, 10 patients had hematologic malignancies, 7 MDS, 3 AML, and 1 B-cell lymphoma. If you look at dates, a total of 35 deaths occurred during this study period. 5 new deaths were reported. All were considered unrelated to cilta-cel, and this is the new report since the previous report at 27.7 month follow-up. 3 from progressive disease, 1 from pneumonia, and 1 from sepsis. So to conclude, at the closeout time, CARTITUDE-1 study shows that a single infusion of cilta-cel provided a prolonged close to 35 months of PFS. This kind of treatment benefits in this advanced patient population has not been reported previously with any therapy, including other BCMA-targeting therapies. At 3 years follow-up, close to 63% patients are alive and almost half of them remain in remission. Achieving CR or sustained MRD negativity was associated with prolonged PFS, and no new neurotoxicities has been reported since the last measurement, suggesting manageable toxicity profile. So together with the results, which is the first in human LEGEND-2, and the randomized result presented also at this meeting with CARTITUDE-4, the long-term data confirms strong anti-myeloma activity, which is sustained, providing long-term benefit in relapsed refractory patient population. This is a significant improvement in this highly pretreated patients. And patients in this study will be continued to be followed for safety in the 15-year CARTITUDE long-term study. This study was supported by Janssen and Legend Biotech. We thank the studies, the staff members, sites, and most importantly, our patient population for participating in this very important study. Thank you very much.